Well, as we've heard, the British royal family discussing medical issues represents a groundbreaking era for a very private institution. But cancer is a condition they share with millions of families across the world. It's estimated that today there are 3 million people living with cancer in the UK alone. Professor Karol Sikora is a former director of the World Health Organization's cancer program. So thank you very much for joining us.
Pleasure.
As an oncologist yourself, you must have experienced the moment when patients receive the news that, of course, no one wants to hear. Do you encounter a range of reactions?
A total range. You know, some people just don't believe it. Some people go into denial, so they say it's not cancer, they're telling me lies, and others just fall apart. Most people cope remarkably well. And the real problem with cancer is the uncertainty of what's going to happen. As an oncologist, I can give no guarantees, even when it's likely that someone's going to be cured and survive for normal lifespan. You can't guarantee that. And that's what's so unpleasant about getting a cancer diagnosis.
So based on everything you've heard, Professor, what do we know about the situation regarding King Charles and the Princess of Wales?
So with King Charles, it was interesting. He went in for a benign prostate operation and they found some cancer cells. They haven't disclosed where the cancer cells came from. There's a range of things. They asked us not to speculate, so we can't really say. But on balance of probability, Charles probably has prostate cancer or bladder cancer. They say it's not prostate, which leaves bladder, but we're not allowed to speculate. With Princess Kate, she had an abdominal operation in January, and 5 weeks later, it's announced she has chemotherapy. So the most common things in the abdomen, of course, are tumors of the intestine, the pelvis, the ovaries, and so on. So without speculating, she's on chemotherapy. And she told us it was preventive chemotherapy. Now, we call that adjuvant chemotherapy in oncology. And adjuvant chemotherapy is given when there's a higher than normal risk of the disease coming back. There's no disease, there's nothing to see. There's no cancer cells on the x-rays, the images, or spreading to lymph nodes. But we know that the risk of the recurrence is higher than normal. And that's preventive chemotherapy.
Now, King Charles and Princess Kate are both regarded as probably among the hardest working royals. I mean, the schedules are pretty much non-stop. And I wonder, considering that physical stress and possibly even psychological stress of constantly being on the go, how important rest would be at such a time?
I think for Kate, it's very important. You know, the worst thing about chemotherapy that we can do very little about is the tiredness you get with it. The sickness we can deal with, a lot of unpleasant symptoms that you get, we can deal with other drugs, but we can't deal with the tiredness. And so I always advise it depends on the regimen, of course, for what disease it is, but I advise all my patients to take complete rest on the day after chemotherapy and then just adapt to how you feel. Don't push it. And you know, I do encourage gentle exercise, walking, you know, it's good for you, cycling if you like, just to keep the body moving. And spring is coming to the UK, and hopefully it's always slow in coming, and that would be a lovely time to go walking in the countryside. I'm sure that's what she will do.
And of course, emotional support is massive. So I wonder how the supportive family could help the patient and also other family members, such as the young princes and princess.
Absolutely. I mean, she did say in her video recording, she talked about the body, mind, and spirit. And that is so important for cancer patients. You know, the chemotherapy, the radiotherapy, if it's used at any point, all the tests we do, and really there's nothing you can do about that. But keeping your mind and your spirit up front and positive about it really helps people to get through it. You know, I tend to be able to judge someone now because I'm a very old oncologist. I've been doing it for nearly 50 years, how they're going to react to things. And so someone like her, I would say, is going to sail through it. And she's going to do what the doctors say, and she's just going to do it and come out the other end, bottle of champagne, little holiday, 6 months' time, and then back to work. That's how I predict it'll unfold.
God willing. Now, you know, with that remarkable length of time you've had in oncology, these 5 decades of experience, you would have seen massive changes psychologically, especially for people. You know, at a time when when you would have first started, I'm sure cancer would have been just quite something of a mystery, the big C, as a lot of people refer to it, and so on. I wonder how much understanding of cancer and perhaps attitude towards cancer has changed and relaxed. I don't mean in a complacent way, but relaxed in terms of helping people get through it.
Well, you know, when I began, again, because I'm so old, we didn't tell people they had cancer. We made up stories. We fabricated things. Oh, a little cyst, a bit of infection. We're just going to give you a bit of radiotherapy, a bit of chemotherapy to get rid of it. And people believed us. Sometimes we'd tell the relatives. And, you know, in Japan still, there is that culture. And indeed, in the Gulf states, some of the older physicians still try and hide the cancer word. You know, when King George V, this was a long time ago, had a lung cancer, he had his surgery in Buckingham Palace, believe it or not. The team from the Brompton Hospital, the Chest Hospital in London, came to Buckingham Palace, took out a lung with the cancer, and it was kept completely secret from the public. That was in the 30s, though. So now attitudes have changed. In my hospital, Hammersmith, we have the sign saying Hammersmith Cancer Centre. That would never have happened when I began in oncology. The word was hidden. Now it's in the open. And what Princess Kate is doing is make it even more open by showing it doesn't matter whether you're king, queen, prince, princess, everybody, rich, poor, black, white, different religions are all affected by the disease.
True, and the thing is that surgery is surgery. We understand that, but words like radiation therapy or radiotherapy and chemotherapy have always been considered kind of frightening words because they imply, yeah, exactly, they imply something that's much harsher in order to tackle the cancer. Now there's a move towards immunotherapy, helping the body boost its own healing, and I wonder how much things have moved forward in that direction to try to reduce the impact of chemotherapy and radiation.
Indeed, there's no doubt that gentler approaches and tailored approaches, personalizing the treatment to the patient is the way forward. And that's what we're seeing now. And I'm sure that's what's happened with Princess Kate.
So I wonder, how have advances in medicine and treatments affected the chances of surviving cancer, providing hope when in the past there might have been perhaps little prospect of recovery?
You know, when I began, 33%, exactly a third were cured of cancer. Now it's over 50%. And that will continue as the century unfolds.
Well, Professor Karol Sikora, thank you so much for your perspective on what's been happening. Well, from all of us here, we wish King Charles and Princess Catherine a full and speedy recovery. I'm Riz Khan from me and the team. Thank you for watching.